Hi, in this video let's discuss the next set of questions starting with SAGM blood storage duration, right? So it's 5 to 6 weeks. We'll go through the literature. The first RBC additive solution, saline adenine glucose SAG, was developed by European researchers in the late 1970s. Soon after, in 1981, the same researchers added mannitol to help protect RBC membrane and reduce hemolysis, which enabled up to 6 weeks refrigerated storage of RBCs at a hematocrit of approximately 55 to 60%. So all these values are very important. And this modified SAG formulation, SAGM, was named as SAGM, and to this day SAGM is most widely used RBC additive solution. So shelf life, or it can be stored for a duration of 5 to 6 weeks as per the literature, right? I think that was one of the questions which was asked recently. Now coming to fluoride varnish advantages, we'll just go through some of the literature pertaining to fluoride varnishes. So fluoride varnish has been described as the most convenient means of professionally applied topical fluoride agent in the management of early childhood carers. This is based on the premise that they are easy to apply and well tolerated. The time required to apply the varnish varies from 1 to 4 minutes per child, depending on the number of teeth present, and immediately following application the child can close his or her mouth because the varnish hardens on contact with saliva and forms a thin film that adheres to tooth surfaces. It is however recommended that children avoid eating for 2 hours following application of varnish and not brush their teeth on the same day. And along with that, in another article it's clearly mentioned that fluoride varnishes have been used at concentrations of 1% and 5% for prevention of early childhood carers. The preventive fraction of 1% fluoride varnish ranged in terms of statistics 6.4 to 30%, and 5% fluoride varnish, it ranged from 5 to 63% in preventing early childhood carers. So maybe these stats are not so important, but the duration of application, the advantages compared to other agents is very important. And to summarize the advantages of fluoride varnish: easy to apply, doesn't require complex dental equipment, doesn't require dental cleansing before application, sets on contact with saliva, safe to use, easily acceptable by infants, children and individuals with special needs, and most importantly, it's not expensive. Right, some advantages pertaining to fluoride varnish. Now coming to encapsulated microspheres, antibiotic which is available in this format, Arrestin, minocycline, you might have heard of this term. So we'll go through some literature. The local drug delivery system, Arrestin, contains the following technology: microencapsulating minocycline hydrochloride in a bioabsorbable polymer as a vehicle. The resulting microspheres are administered in powder form into diseased periodontal site. Immediately upon contact with moisture, the polymer begins to hydrolyze and release minocycline, and the administration results in a sustained local release of antibiotic with concentrations of 340 micrograms per ml have been measured in human crevicular fluid even after 2 weeks time. So encapsulated microspheres, minocycline is one drug which is available in this format, and the trade name or the commercial name for it is Arrestin, right, for sustained release at diseased periodontal sites. Now coming to histones. So what about histones? What kind of amino acids do they contain? Basic amino acids. We'll go through some literature. Histones are class of protein molecules found in chromosomes of eukaryotic cells. They complex with DNA and pack DNA into tight masses of chromatin which have the structure of coils, much like a tangled telephone cord. The molecules are strongly basic and are of relatively small size. The molecules in histones are basic. They also serve a function in the transcription of DNA. The histones are rich in amino acids like arginine and lysine. The 5 major subtypes of class differ from one another chiefly in the relative amounts of these 2 amino acids. So they have been greatly conserved during evolution. Histone structures vary little in a wide range of organisms. So they mainly contain basic amino acids in specific arginine and lysine, right? Now, coming to systemic inflammatory response syndrome, we have discussed about SIRS in detail in one of the videos in e-classes as well as in our YouTube channel, right? So just go through the video. And so the question is, systemic inflammatory response syndrome is associated with multi-organ dysfunction syndrome, septicemia, septic shock. So the answer is sepsis. In Davidson, it's clearly mentioned that in cases of sepsis, it can be infection or other causes of SIRS. They produce widespread endothelial damage with vasodilatation, arteriovenous shunting, microvascular occlusion, tissue edema, resulting in organ failure. Right? Very, very important, and we have discussed in detail about SIRS and the components of SIRS in YouTube as well as in our e-classes. Do refer that video. Now, coming to next question, reversible hydrocolloid from salt to gel and gel to salt happens due to temperature, filler, plasticizer. I think there were some of the options given. So this reversibility is possible because of temperature changes. We'll go through some literature given in Phillips. So there are basically different mechanisms of setting. Reversible materials such as agar as well as impression compounds soften upon heating and solidify slightly above body temperature with no chemical change taking place. Agar, it's a reversible hydrocolloid, as you know. The physical change of agar from salt to gel is induced by lowering the temperature, and gel liquefies to salt when it is heated to a temperature known as liquefaction temperature, 70 to 100 degrees centigrade. When salt is cooled, it becomes gel at a point known as gelation temperature, which is between 37 degrees to 50 degrees centigrade. Thus, it is called as reversible hydrocolloid. And the gelation temperature is critical for impression making. If it is too high, the heat from the salt may injure the oral tissues. Conversely, if the gelation temperature is too far below the oral temperature, it's impossible to make the impression because the salt will never convert to gel. So all of these consequences we have already discussed in our e-classes, but this change is possible mainly because of temperature changes, right? Now, so every year there seems to be a question on gene to complicate the matters further, to terrorize you. So anyway, CBFA1 gene. So it's associated, or defect in this gene is associated with which of the following syndromes? So cleidocranial dysplasia, also called as Marie-Sainton's disease or mutational dysostosis. We have few other names. Cleidocranial dysplasia. It's a congenital disorder of bone formation manifested with clavicular hypoplasia or agenesis with narrow thorax, which allows approximation of shoulders in front of the chest, as you can see in the image. The syndrome is familial and is transmitted as autosomal dominant trait. So that's what I was telling to one of my students recently. Many syndromes, you have this mode of transmission, autosomal dominant or recessive, sex-linked, right? So make sure you enter all of these exclusively in a separate page in your notes, syndromes and their mode of inheritance. And during revision, all of this is going to help you build confidence enormously, right? So cleidocranial dysplasia is transmitted as autosomal dominant trait. Several chromosome abnormalities have been reported to be associated with this syndrome, including rearrangement of long arm of chromosome 8q22 and the long arm of chromosome 6. Mutations in core binding factor alpha 1 CBFA1 gene located on chromosome 6p21 have been shown to be the cause of cleidocranial dysplasia, right? Now, moving on to next, phoenix abscess, the one which we are very familiar with. Acute exacerbation of chronic abscess is nothing but phoenix abscess, and there are radiographic changes as evident in the image which you can see now. So to go through some literature, the term phoenix abscess relates to sudden exacerbation of a previous symptomless periradicular lesion. It can be one of the most troublesome conditions to deal with and occurs after initial instrumentation of a tooth with a pre-existing chronic periapical lesion. Right, so we'll not further go into the details of this phoenix abscess. So phoenix abscess is acute exacerbation of a chronic periapical lesion. Now, penultimate topic, pacemaker. So a straightforward question. SA node is body's natural pacemaker, and in the upper part of right atrium of heart there is a specialized bundle of neurons known as SA node. Acting as the heart's natural pacemaker, SA node fires at regular intervals to cause heartbeat with a rhythm of about 60 to 70 beats per minute in case of a healthy resting heart, right? So natural pacemaker is SA node, right? Now, moving on to the final topic of this video, siderophages, heart failure cells. You might have heard of this term. So siderophages, these are heart failure cells. They are nothing but hemosiderin laden alveolar macrophages found in case of lungs, right? So brown induration in lungs as a result of small hemorrhages as occur in a case of mitral stenosis and left ventricular failure. Microscopy reveals presence of heart failure cells, siderophages, which are hemosiderin laden alveolar macrophages, right? And as you know, hemosiderin is the iron which is stored in the tissues, mainly in two forms, ferritin and hemosiderin. So these siderophages are seen in case of lungs. They are hemosiderin laden alveolar macrophages. So these are some of the topics which I wanted to highlight in this video. So we'll make more videos with more topics as soon as possible. I hope it's clear.